Appreciate you being here. I want to start with that number that Jed just read, though. The number of cases going from 2,000 now to 3,000 today. These are new numbers. Deaths from about 50 to 57 or 60, depending on where you're getting the source. What do you make of those increases?
Well, Mayor de Blasio, I was with him on Friday, doing a little bit of a program, and he's clear. We're going to have 1,000 cases in New York, he believes, this coming week. So this ascent is what we would have expected. What we do hope is over the course of the next 2 weeks, the initiatives that you saw countrywide this past week will take effect. It takes about that long for public safety initiatives to make a difference. And when we start to see a slowing of that ascent, that curve sort of begins to level out of new cases, that's what we're looking for. That's what happened in China. If you look at the Chinese data, outside of Wuhan, as soon as they imposed the largest embargo quarantine ever in human history, 60 million people, they quickly slowed the growth outside the Wuhan province, and to this day, it stayed low.
Isn't this a good thing that we're now knowing how many cases we've got, have the pain all the way up front, get the big number all the way up front so we know what we're dealing with?
Stuart, you know I'm a surgeon. I still operate. Most important thing I ever teach residents is tell the patient when you're going to hurt them. They can deal with it. We're a remarkably resilient species. You tell Americans, here's what's going to happen. It's not going to be good. You're not going to be happy about it. But once you know you can cope, we're can-do people. Having this expectation out there takes away a lot of the things that were causing panic, because every hour something new is happening that surprised you. Well, it wasn't surprising, frankly. It's exactly what we expected, except it happened at a different pace in different places, because you never know who the patient's going to be that infects 130 people, like happened up in Westchester. But once you identify that, the rest is predictable. That's why we know New York City is going to have a problem this week. Thankfully, because we're prepared, and the hospital system here is up to gear on that, because we had 5 extra weeks since the Chinese embargoed Wuhan, we've got a little breathing room.
Dr. Oz, are you concerned about some of those images that we've been seeing in the airports of the crowding, and some of the reports that people are saying their temperatures were not taken? There's this extensive screening that they claim is happening, but a lot of people are saying, I'm not really being screened at all except being asked a couple of questions. Does that alarm you?
It's bothersome, because I think we have to create a new normal where that is expected and thus everyone does it. I mean, did I shake any of your hands out here? Right. In 1 week, we changed a tradition that demonstrated I was free of arms and we were bonding to it's now gone. It's actually insulting you to expose you to my virus. That stated, listen, we're not going to kill this just by checking temperatures of people walking in the airports. We know that this virus can be secreted from people who are asymptomatic. So just because you don't have a temperature doesn't mean you're safe. Now, if you have a temperature, don't get on the plane. But that's the thing you should accept. That's why that gentleman who flew down to Palm Beach on JetBlue is, I understand, banned from that airline forever.
Yes.
And I think that was actually inappropriate behavior. If you're being checked, if you think you're sick enough that you got checked for coronavirus, you should not be interacting with other people.
Right.
Yeah, it's pretty simple that way. Well, they are doing temperature checks at the White House, checking reporters come in. One denied because their temperature was too high. Another part of that is the president was asked multiple times, would you take a test for coronavirus? Well, yesterday we learned that he did. Here's what the president said after taking the test.
I had my temperature taken coming into the room. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
So later yesterday, his physician came out and revealed that the test was negative. Here's a part of the statement. Last night, after an in-depth discussion with the president regarding COVID-19 testing, he elected to proceed. This evening, I received confirmation that the test is negative. 1 week after having dinner with the Brazilian delegation in Mar-a-Lago, the president remains symptom-free. Dr. Oz, your response. Should he have taken the test? Obviously, it's good that it's negative. Your thoughts?
From a medical perspective, no, he shouldn't have had the test. He did not meet criteria, didn't have a fever, didn't have symptoms of dry cough or fatigue. So I wouldn't have given the test if he came to my office. However, he's the president. Right. So you want to make sure he doesn't infect the next president who visits him. And giving people that level of confidence, albeit he'd have to be checked frequently if you were going to take that philosophy to make sure he didn't get infected, would be wise. We're already seeing countries being impacted by their leadership getting sick. It's going to happen more and more. Quarantining the leader of a country is a big deal.
It's a political thing, too. Yeah. I mean, you have to take the test, for heaven's sake. You're the president of the United States. You can't separate yourself out and say, no, the test is not for me.
But, Stuart, let's flip it. Now that he got tested without any symptoms, why wouldn't the average person say, hey, just test me, too? I don't want to get my kids infected. I want to know if the folks I'm working with are exposed to anything. Let me just to make sure, get me tested. We don't have enough units. Right. We can't get people tested who probably should be tested.
But if you know that someone has had contact, for example, if you know someone has shaken the hand of someone who did test positive, don't you assume in your mind, well, this person then could be asymptomatic and pass it on? So don't you feel obligated to have to test them if you know they've had contact with someone?
If I had enough tests, I would test every single American right now. I'll tell you why. Because it would give us epidemiologic data about what's really happening. I am positive that I know people who were infected and didn't even realize it because it happened before we thought coronavirus was here. There was someone I know of who actually was at a party at the Oscars with the cast members' Parasite, a Korean movie, who got fevers, shortness of breath, fatigue. I have no idea whether he had coronavirus or not, but he thinks he did. And you hear these stories and you realize this has been around. A lot of people had it, didn't even realize it. 80% of people have very subtle symptoms, subtle in that they have a fever most of the time, but nothing that would catch your eye. And so we don't actually know how often it's out there. And I interviewed a person on my show last week who's 40 days out from his virus. He's still secreting virus particles, and not just from his nose and his mouth, from his eyes. They're checking him rectally. Wow. Also there. So once it's there, it sort of spreads risk. But just shaking someone's hand, it doesn't mean you're going to get it, especially if both of you washed your hands.
Are we doing the right thing? Washing hands frequently, wiping down surfaces, avoiding social distance, making social distance.
Washing your hands alone is probably a 50% reduction in virus transmission. It's a DIY vaccine.
Really?
It's that powerful. And I know later in the show, because we've got lots of questions from viewers, and please send us your questions if you have them. I'm going to tackle some questions about what happens if you do get sick. But that's the best way to stay out of the bed. But the most important thing is social distancing. And the question I thought you were going to ask is, are we overreacting? And having spoken to a lot of the leaders, they have, if you see the data, and I saw it earlier this week and just got published in the Times yesterday, about how widespread this virus becomes and how quickly it grows, we do not want to be Italy. And you're better off, if you're an elected official, overreacting a little bit, shutting down some things that maybe didn't have to be shut down, and then loosening it up.
So we're going to see curfews, we're going to see closing. You're saying, these are going to be natural reactions to managing this.
It is. And that's why, as an example, we actually want to make right now a digital vaccine. Right? We want to use some of these tech companies and their remarkable assets to build us tools to see, okay, exactly where is the risk? Not like generically New York City, but exactly what street in New York City is a problem.
Well, speaking of that, the president did announce, and others, that Google will be partnering with the Trump administration on a nationwide coronavirus website that'll include information on symptoms and testing details. They said firm details released today at 5 o'clock. What do you make of this website and that information?
Well, Google quickly backstepped, said, wait a minute, we didn't even know this was happening. And that's not shocking because it's hard to do what was promised by 5 o'clock today. But I know for a fact that there are companies that are leading in this area, companies like ShareCare, that there's all my website stuff as well, that have been offering content to the World Health Organization already, to the state of Georgia, which is really out in front of this, saying, okay, here are the exact areas that are at risk. Here are the socioeconomic determinants. Here's their stress levels. Just very detailed amounts of information. And then you can overlay that with where the virus is hitting. You can begin to predict who's going to have problems. I know Amazon's working in this area. Facebook has initiatives. It's not just Google, but America is the leading technology country in the world. These companies already have a lot of assets. They don't have to build only brand new stuff. They just have to merge their skill sets, like companies that are already doing these. Facebook already knows a lot about your behavior online and social space. Align that up with your behavior when you get coronavirus. Now we can begin to predict, hey, you know what? The way you're behaving, I think you might have coronavirus. So here are the 3 reasons why. If they can tell us exactly who's going to vote for who and how to target them, they can definitely tell us who's at risk of getting coronavirus.
Because they've got the information in the first place.
Exactly. Just lay it over with the testing that's available, and we got a real great solution.
It's also a little scary how much they know.
That's also scary, but this is a good reason to know that information. It's being used for nefarious purposes, but this is a reason why people in public health actually appreciate data being sought after. Because this is a way of me auditing you without you even realizing you're making the mistake. I can identify, and this is historically how medicine's advanced, identify trends that people don't appreciate before they know it. That's how you save lives.
Well, you have the White House right now signaling a 3rd relief bill. The administration doing everything it can, it seems, at this point to fuse the public sector, the private sector, along with the federal government, the state, local officials. Is there anything, as a doctor, when you look at the measures that are being taken, are there any red flags, or are there any holes that you see that need to be filled in order to guarantee that we don't further spread the virus, so that we protect people who actually don't have the virus, or even people who may be asymptomatic and have the potential to spread that virus to more high-risk groups of people?
So the Achilles tendon in this whole system is the hospital. Right? You got to have a hospital that's healthy and able to be functional. In order for that to happen, people can't be scared about going to the hospital, and they have to actually feel comfortable with the finances. The number 1 cause of stress in America is financial stress. and it drives so many of the decisions we make. So the bill is a huge step forward. I worry about the homeless, the indigent, who aren't even reading about this bill and don't realize it's possible, but it does make a big dent in helping the undercovered individuals feel that they might not have a huge bill at the end of the day. 80% of folks do well, stay at home, don't run up a bill, stay out of Dodge, don't pass go, don't collect $200, you'll be fine. But for the 20% who feel ill, have to go to the hospital, we can't have them waiting to the last second. It's harder to treat them. And more importantly, the amount of money we're going to spend saving lives, because we have tools now that will dramatically change the course of people go to the hospital, but a patient who dies in the ER is a relatively cheap admission. If we can keep you alive, it might take us 2 weeks to save your life, and which is the right thing to do. It's a lot more expensive for the system, and someone's going to have to cover that bill, and that's going to dramatically drain the resources of state and municipal governments who don't have that. They can't print money.
Yes.
And that's where the government steps in, absolutely. Well, Dr. Oz is going to be with us all hour. If you would, email us, friends@foxnews.com. He mentioned it, friends@foxnews.com is the email. He will be answering your questions. Thanks again for being here, Doctor. We appreciate it.